Welcome to Solutions for the Mind. Today I am joined by Jessika Sheppy, who is a clinical hypnotherapist and specialises working with people with brain injuries and other traumas. She helps many people who have lifelong chronic pain and talks about her own experience using hypnotherapy to help support with her own chronic pain issues. She breaks down how hypnotherapy can support by creating small, achievable goals and helps in terms of relaxation so that people can manage their pain more effectively.
This is Solutions for the Mind from the Association for Solution-Focused Hypnotherapy.
Hi Jessika, it's really nice to have you here with us today, and we're really excited to hear all about what you do. So I can't wait to find out a bit more about that.
Hi Emma, yeah, thanks for having me on. I'm really looking forward to chatting with you about my work.
So do you want to tell everybody a little bit about what it is that you do with your work in neuro-rehabilitation?
Yes, so I've been working in that sector of neuro rehab for about 8 years. It's quite a different approach for people, that ability to just stop and think of solutions when they're in the middle of that traumatic experience and facing their future. The clients that I typically see will have spinal cord injuries, acquired brain injuries, stroke patients and other complex traumas, including amputation. They kind of are coming for physical rehabilitation, but their mental health is obviously that overarching theme that we find. But some of them are just not ready for psychology because they are, within a year of their accident. So just being able to check in with their nervous system, slow things down, is really been kind of amazing for them.
Oh, that's really interesting. So does your role with the solution focused hypnotherapy side of things kind of work with both sides, the physical and the mental side, or is it specifically around the kind of mental well-being?
No, I work kind of both really, because obviously the mind's eye and the imagination is really powerful. So if someone can imagine doing something better than they've done before, that can either be physical or mental, I've found from my experience.
Okay, so using the techniques of solution focused hypnotherapy, you can support that person in terms of using their imagination to help them with both their recovery and also improving their kind of well-being, their mental health.
Yeah, yeah, that's right. It's interesting because these people, their lives have changed completely overnight. So a lot of them cannot see that future. And that's a lot of what is in our training, imagine the future a little bit better and scale it. And so a lot of them, they can't do that. They're at rock bottom. And to speak about those things can be hard for them. Really just working with them and where they are on that day has to be really important. And a lot of that is pain, sleep, anxiety, stress, the usual things that we see. So it's just framing it around their needs. Yeah.
So what kind of changes do you most notice in working with these clients? If they're coming to see you and they've just recently had an accident and they're, like you said, they're struggling in terms of seeing their future, what's the difference then after they've worked with you? How are they kind of ending that therapy and feeling?
They are more in control of their negative thinking, I would say. They're more in control of their lives again.
Mm,
When your sleep is knocked off, and you're in pain and you're feeling all these emotions outside of yourself, like your family, your work, um, just to be able to stop and talk to someone in that positive way and
mm.
imagine what it would look like just tomorrow. And that would be even just, oh, I'd just be able to get my socks on myself. Then that's what we'll do. And then we'll kind of frame it around that.
So taking small steps towards the
Yeah.
future rather than trying to imagine how completely different life might be, working within what is possible. So it's quite like affirmative in terms of supporting them with language that feels kind of good and positive as opposed to something that feels more negative or unrealistic.
Yeah, because they've just maybe come out of hospital, and although th they're getting care, sometimes they've had to listen to a lot of negative things about themselves, and they don't really know what's possible.
Yeah, I can imagine that must be really difficult if
Yeah.
they have had medical feedback, perhaps, and maybe some limitations of what they believe is possible. So, kind of working to look at how that might be something you can help them and support them with as well in terms of what they might be able to achieve. It sounds
Yeah,
really positive.
yeah, and it's not just the physical limitations, it's like being, in a wheelchair and not being able to walk, it's everything that goes with that.
Mm,
It's your temperature control, being able to eat and drink yourself, and just feeling that total lack of independence
yeah.
has been taken, and you're relying on other people all the time, and then that just eats away at your identity, really.
So, for somebody that is living currently with chronic pain, and so if it's not something that is structural, it's something that potentially we would be able to get some tools and techniques that you'd be able to manage, which would help you to deal with that pain. What
Yeah.
types of pain are effectively managed using solution focused hypnotherapy?
I think the pain in my experience, we've got quite a different range of pain at steps. A lot of it is phantom limb pain. So if a client has had an amputation, their body still continues to feel that limb. And it's obviously it can be sensations, it can just be tingling, numbness, or it can be shooting, twisting, burning pain in that foot, which is or arm, which is no longer there. So that's very scary. And it
Mm,
usually comes on at night, which obviously is the worst time because you feel all alone and at night everything's worse, isn't it?
mm,
But so if they use hypnotherapy, I've found that the clients have been able to reconnect with those parts of their body. So closing
mm.
their eyes, going into trance, they follow the progressive muscle relaxation down their body and they're able to reconnect with that part. And then that way they're telling their nervous system, everything's all right. Here's the limb. Don't worry. So when they come round, their pain has gone down. Usually, if it's because I do a lot of scaling, like 8 out of 10, it goes down
Yeah.
to 2, 3 out of 10. Um,
Wow, that's
and it's
amazing.
being able to hold on to that feeling as they go about their rest of their day, saying,
Mm,
well, you have reduced it without meds, with just the power of your mind. And it gives them a bit of hope that it's
yeah.
possible.
That's
Yeah.
incredible. And these are techniques that they can learn and then they can implement on their own outside of sessions with you.
Yeah. I do try to, alongside the sessions, I give them that homework, as it were, to do that self hypnosis on themselves. Yeah.
Okay, what does self hypnosis mean then for people who have got no idea what we're talking about here? How would you describe that?
I suppose it's about regular practice at first. So, kind of twice a day, taking some nice deep breaths, closing your eyes, or just listening to the sounds around you, connecting with your body, and maybe developing a safe place in your mind's eye, like a nice place where you can go to. I go to the beach, and you can develop it, and you can just drop into that space and just have a few moments there. And in that space, kind of anything can happen, but it's your imagination, really. Connecting with your body, I suppose anyone can do, but
Hmm.
that imagery, so people sometimes don't have as well developed like mind's eye. They close their
Right,
eyes, they don't get the images. So I always say that's on a bit of a sliding scale for people, but it doesn't matter. It doesn't make any difference. Your body's still knowing the sense of it, even if you're thinking the words beach, what that means to you, it's still connecting to that feeling.
that makes sense. So that the experience might be slightly different, but the techniques are things that can be applied to anybody that can practice it in their own time and get. And is that something that you find that they get better at? Is it a skill that you can acquire, do you think, to kind of go into that state?
Definitely. Yeah, I think so. I had a client who had no mind's eye, and I saw him for a long time, and that developed in from colours. He was seeing colours into visuals. So it is definitely something you can get better at and train your mind to do.
So, if you don't mind, it'd be really interesting to find out a bit more about your background. So, how it is that you first kind of discovered solution focused hypnotherapy yourself, and what it was that drew you to that.
Yeah, so I suppose it started a long time ago. My daughter's 16, and I found out about hypnobirthing through a friend, and it really made sense to me and my husband. So we did a course and had a really successful hypnobirth with two hypnobirths. They were amazing, and it was about the same time that I started in care work and that sector. So it just grew from there because I saw the potential for that more positive, slow, steady approach. And from that, I think I've learned so much about my own pain because I had chronic pain for many years, and also just how to be more mindful in the moment.
So, tell me then, how has it made a difference in how you manage your pain and the way that you deal with those things in your life?
I might, you might pull you back, but before I would have been catastrophizing, thinking, oh, this is it. I'm going to be out of action for a week. I'm not going to be able to do this. I'm not going to be able to do that. And my muscles all kind of tensed up. They were all primed to hold all that tension. And it became
Mm.
so debilitating. I had to have lots of time off work. And because I work in the sector that I work, I think I started getting the fear that something was happening to me.
Mm.
So that's the power of the mind, isn't it? You start to believe, um, and you start to think it's happening to you, and then it kind of, your brain can actually make you feel more symptoms. I was in a wheelchair at one point in A&E, not being able
Wow.
to feel my legs, nerves,
Wow.
and then it wasn't until I had an MRI scan, and I went to see kind of a private surgeon, and he said, your spine is perfect. There's nothing wrong with
Mm.
it. And he showed me the scan, and it's that image of the scan that I go back to remind myself that my back's absolutely fine, and I've got nothing to worry about, and I have to just steady myself. Yeah.
Yeah. So, for you then, in having some techniques that you can use then to support you when you've got that pain now, does that pain ever come back again, or is it something that you still experience?
Okay, so last week I slipped, my leg flew out, and it was the same pain in my back, but I just used all of my techniques and just was positively switching it in my mind. And it lasted like 24 hours, like a normal slip would happen, instead of that
Yeah.
embedded pain feeling where it's just not going to shift. It comes and goes as with anyone, but I am able to manage it.
Are there any other kind of long-term, like chronic pain conditions that you tend to work with, or you think would be really something that solution-focused hypnotherapy could support with?
Nerve pain, when kind of tends to be the basis of, your muscular pain is going to kind of improve, but
Uh-huh.
nerve pain lingers around. And I think that people then move differently,
Yeah.
and then they plan their route to work differently, and they build their life around it. Headaches, um, you know, um, migraines and things like that. Yeah.
Yeah. So that's interesting that you mentioned people kind of change from the pain, so they start to make adaptations in their life, perhaps. In your
Yeah.
experience, is that something that you think then you can remove, so we could get to a point where they're not having to do those things and they can live without making those adaptations?
Yeah, I suppose if they feel that those adaptations are limiting them,
Mm.
then it's a benefit for them to try something new. I had a client who had a very, very painful back, and he adapted the way he sat, his sleeping, the way he
Mm.
walked to work was very specific because he didn't want to step down too many steps or cambers in the road. He didn't want to have to cross the road in a certain area because it might jar his back. So every single thought was going into that stress bucket of, I'm going to hurt my back. I'm going to make it worse. So we just started off by reimagining how he would change and move more freer.
Yeah. Wow.
And what he would see if he walked, what he would see if he walked a different way to work, and what might happen, who he might bump into, and all the positives that would come with that little change.
Yeah. So it can actually change people's whole lifestyles as well as managing the pain itself. It can change what they're able to, or what they see they're able to do in their days.
Yeah. Yeah, I'd say that it definitely can have that ripple effect out. And that's the beauty of solution focused hypnotherapy. You don't know what's going on in your client's mind.
Mm,
You can be doing what you do, but they're doing far more in their mind during trance. Yeah.
yeah. So the way that you work with clients is looking at what they hope that they can achieve or small goals, and then you're using their imagination to allow them to see what that might be like, to experience how it might be to achieve those goals. So it's very much based on what the client wants, as opposed to, like you said, what your expectations are from them.
Yeah. Yeah. I try not to have any expectations from week to week. Um, but I do find that they always surprise me. It's that lovely kind of growth that you see in someone that, it's
Yeah.
the journey you go on with them. Yeah.
So I'm not sure in your role at the minute whether you have clients who are having other types of therapy. Is that people are often having kind of the physical therapy at the same time as coming to see you?
Yeah. They're usually in the thick of it, really, in intensive rehab. They're out of work. They are just focusing on getting better. And that's physical physiotherapy. They've got occupational therapists, and they've got usually speech and language as well as other kind of psychological based therapies, music therapy, art therapy.
So a full range of
Yeah,
therapies. And
full range of therapies.
with what you're doing then, that works really nicely alongside all of those different therapies. So somebody, if someone's listening and they're going through physical therapy at the minute, but they haven't considered perhaps, working with a hypnotherapist, that would be something that would work quite well together.
Yeah. Yeah, I think so, because if they are working on accessing the community again, and they've got that, they're really nervous, either through PTSD or just feeling, nervous about getting outside again, then I can work alongside confidence and self-esteem. If they've got body image fears, then I can help with that as well. Speech and language, I've worked with people who have had swallowing problems,
Oh,
and get them to imagine swallowing, get them to really use that in trance. So I've got people to, when they're having hand therapy, imagine that they're taking items out of a box or they're touching something in their trance, just to reconnect their subconscious with their hands again. Yeah.
wow, that's amazing. Yeah, so there's so many facets to it in terms of, managing the pain itself, but then also the kind of the changes that somebody might have experienced in their life, which would have an impact on how they live, and then on their self-esteem and the way they see themselves. And you mentioned trauma in there too as well. So
Yeah.
I
Yeah.
suppose it's taking all of those things and finding that solution focused hypnotherapy can actually support all of those different aspects of that person, which is incredible, isn't it?
It is. It is really. When you think about it, it can support someone wholly, um, especially if you kind of get to know that person and you establish that relationship and rapport with them early on.
Mm. So if somebody who is listening is dealing with chronic pain at the minute, do you
Yeah.
have any tips or advice on things that they could start to try today that might support them somewhat with their pain?
So I think if you're struggling with chronic pain, it's important just to put yourself first, reach out and get some help. I think that's the first thing. You don't have to live with it.
Mm,
And also it's about acceptance. So even if we can't immediately remove that pain, it's about, well, accepting it a little bit, making room for it in your life without the negative connotations of it. Over time, that will reduce the nervous system's response to that pain. And it just starts with looking after yourself, your fatigue, your digestion, putting that time in for yourself where you're seeing people and having those endorphins, serotonin, instead of, all the stress hormones. So then your sleep will hopefully improve and you'll just start to feel more positive, like you could do something. So, but it all really starts on looking after yourself and putting yourself first for a moment.
How important is it that somebody believes that they can make an improvement, do you think? So if somebody is looking after themselves, do you think they have to also believe fully that they can improve their situation, or can it still make a difference even if they're not sure yet?
I think that obviously, I think it helps if a person's on board at first. It helps my job. But the way I work in neuro rehab, my clients aren't seeking me out. I'm going to them and offering services. And I have come up with, the people who have not wanted to see me or not
Mm.
believed, have been very cynical. And I just go slowly. I just put them in trance, get them to close their eyes is the first step. And then I go back and I'll do 5-10 minutes and slowly. And I've never really been turned away from it after that. And those people who were the least believers actually end up making the most progress most of the time, because it's even more of a thing because they give up control. Those people who don't believe it will happen, they usually tend to be quite people who've got a lot of self-control and quite
Mm.
nervous about letting go, they can't trust themselves. So to be able to, for those people to stop, close your eyes and not trust someone else in the room is really powerful. So then, yeah, you are getting the benefits in a different way.
That's amazing. So it's not a case that everybody who comes see you has to be totally on board and fully believe that they can get, better and recover. Just having that option of being able to kind of take away some of your, like you said, that controlling part of their brain that's,
Yeah,
give that bit of a break, then there's still just as much opportunity for them to make those changes, which is great.
yeah, yeah.
So, is there anything else then that you think our audience might like to know about the work that you do, or that would be useful for them to understand in terms of how hypnotherapy can support with rehabilitation?
Well, I think it's just that understanding of the mind-body connection.
Uh-huh.
And people are very focused on getting better. And then that's the physical, puts them more under physical pressure and stress. So I think just really understanding that when you connect the mind and the body together in this way, you can come up with that consistent approach, which allows someone to really bring down all those hormones.
We really hope you enjoyed today's episode, and if you do, please do subscribe to our channel.